think in the EV-302 trial, the update here shows that EV-pembro continues to perform really well. And the complete response held up at around 30%. And the duration of overall response, the median DOR was around 2 years, around 23 months. The duration of CR appears to be quite long. We haven't reached the median duration yet. If you recall, with Gemcis nivolumab in the checkmate 101, the duration of CR was 37 months, a little more than 3 years. But these data also look very promising for the duration of CR, and potentially we'll see something on the lines of close to 3 years. We'll wait and see, but it does look like it's exceeding 2 years, the median duration of CRs. I think there's no new safety signals of concern at this point. We do know from the EV-302 trial that the median number of cycles of EV given were 9 cycles, and pembrolizumab around 12 cycles. So really, we know the median PFS was around 1 year. One of the interesting findings in this trial is that survival is very long, so around 31 months, right? So 2.5-year median survival is very, very impressive. And I did also want to highlight in this context that the EV-103 trial, the early phase 1B trial, which looked at EV-pembro as first-line and cisplatin ineligible. In that trial, the response rate looked about the same, around 65 to 70%. In that trial, 5-year survival was 40%. That's very, very impressive because usually the 5-year survival parallels the CR rate. If your CR rate is 40%, you would expect a 40% 5-year survival. In general, that's true, but what was interesting in that trial is the CR rate of around 15% in that EV-103 phase 2 cohort. They still had a 5-year survival 40%. So it is interesting because the long survival, even after progression, suggests there is some modification of the disease biology. There might be some slowdown of the disease, or maybe patients remain sensitive to other treatments. We don't know. We need to figure this out. But there is certainly a survival that seems to be exceeding what you would expect from the PFS. Yeah, what was seen in this was there was not a huge differential impact in outcomes based on sites of metastases. That's a little bit different than what was seen in checkmate 901 with Gemcis nivolumab, where there was a huge differentially greater benefit in patients with lymph node-only metastases. EV-pembro does not seem to discriminate based on the sites of metastases, so whether you're liver metastases or visceral or lymph node only, they all seem to benefit about the same compared to gem platinum. So that's interesting, and I think that more work needs to be done on the performance status 2 patients, because there were not a lot of PS2 patients in this trial. It was under 5%, and PS2 patients who also had renal dysfunction were not allowed on the trial. So we do have to be careful selecting the PS2 patients, and some more work and the real-world outcomes need to be accumulated in that population.